Well, good afternoon, everyone, and welcome to this Inclusive Spaces session run by the Bartlett Faculty of the Built Environment at University College London, UCL. My name is Iain McKinnon, and I am one of the co-founders and directors of the Global Disability Innovation Hub, or GDI Hub, a research and practice centre housed within University College London. And in fact, we've just moved to our new facility over at 1 Poole Street at the new UCL East campus on Queen Elizabeth Olympic Park in East London in the UK. So I am delighted to chair this Inclusive Spaces session today, which is going to look at disability inclusive design for climate resilient cities. Now we have an excellent panel who I will introduce in a moment. Someone's saying I'm muted. Hopefully you can all hear me all right. But first of all, let me do some housekeeping. And if anyone else has any issues hearing me, please let us know. So this session has captioning enabled. If you do require captioning, please push the closed caption button on screen. British Sign Language, BSL interpretation is available. Our BSL interpreters will be swapping between speakers, and so we will leave a short pause between speakers to allow them to do that. You can pose any questions that you have to the panel through the Q&A box. The chat functionality has been turned off, and the slide deck should have been shared with attendees who require it in advance. If that's not been the case and you need it separately, please do let us know. And if there are any issues with accessing the interpretation or the captions, again, please just contact us using the Q&A function. Finally, I just want to make everyone aware that this session is being recorded. So we have an excellent panel of speakers for you today. Mikaela Patrick is a senior researcher at GDI Hub and will talk about resilience and inclusion in urban development. Anna Landry is a PhD candidate at UCL's Department of Computer Science and will talk about disability and the built environment in climate-driven humanitarian crises. And we have Shivani Gupta, a technical advisor on inclusion for CBM International, who will discuss the priorities for Asia and the Pacific region. So we're going to go through each panel speaker in turn, and we hope to have left some time at the end for questions and discussion. So I will pick up some questions from the audience as we go. And as I said, any questions you do have for us, please do type them in the Q&A box. So I am going to do a very quick introduction before handing over to our first speaker, Mikaela. I lead GDI Hub's inclusive design team, and we do research, we deliver on programs, we do consultancy, we do global advocacy, training and teaching on a number of topics, but the topic that I lead is inclusive design of the built environment. So this includes delivering a module on the subject as part of our UCL awarded master's course, our MSc called Disability, Design and Innovation. Collectively, we bring considerable sector experience, and personally, I was the inclusive design lead for the legacy development that took place on and around Queen Elizabeth Olympic Park in East London following the 2012 Olympic and Paralympic Games. However, our work now is mainly internationally focused and increasingly looking at supporting the creation of disability inclusive and climate resilient cities in developing countries, with a strong focus on Asia and the Pacific region and Africa. An example of this includes work we've been doing with clients such as the Asian Development Bank, with whom we co-hosted a side event at COP26 in Glasgow last year, one of the very first events on disability ever to be hosted at the climate conference. The side event recognised the research that we've been doing and a growing interest in the region on the nexus between climate resilience and disability inclusion in urban development. The session was well received and has led to continued and ongoing collaborations. Many cities in developing countries are experiencing rapid growth and urbanisation, as well as delivering large new infrastructure projects, many of which are tackling the growing need for climate resilience. Drawing on our inclusive design knowledge and experience, working with local people, local agencies, and local communities, our hope is to ensure that opportunities to embed inclusive design in these projects and in these places are not missed. The image on screen shows Kibera, an informal settlement in Nairobi in Kenya that we had the honour to visit last month as part of our ongoing research work. So why cities? Well, our current research that Mikaela is going to talk more about is highlighting the intersection between climate change and disability inclusion in cities and the need for action. Climate change can create additional barriers for persons with disabilities living in our cities as a direct result of adverse weather and disasters. And equally, our response to climate change can create additional barriers, the classic example being raising buildings to prevent flooding and in turn creating very inaccessible places. However, cities also present an opportunity. In the run-up to 2050, 90% of our urban growth will take place across Asia and Africa, places where climate change is most keenly felt. And 60% of the infrastructure we will have in 2050 doesn't exist yet. Much of this development will take place in cities. Therefore, cities present a huge opportunity to build better infrastructure that is both climate resilient and disability inclusive. And then why disability inclusion? Well, climate change adversely affects people living in poverty, and around 20% of the world's poorest are persons with disabilities. Around 15% of the world's population are disabled, which is about 1.2, 1.3 billion people, with 80% living in low-income countries, many prone to climate disasters. Therefore, beyond the fact that inclusion is a fundamental human right, if we don't include this huge and growing section of the population, then our infrastructure will simply not be fit for purpose now or in the long term. It will not be sustainable. So getting this right first time will benefit all of us, serving both people and planet together, and we must ensure we include persons with disabilities in the response. Finally, from me, one of the ways we believe we can help achieve this is applying an inclusive design approach. Embedding an inclusive design process to all projects, including those addressing climate change, ensures the hardest to reach voices are present at the start of the conversation. And only by having that representation, genuine involvement and leadership will solutions be delivered that meet all of our needs, supporting stronger, more cohesive communities that can thrive in future. And on screen, we have a quote, which is our GDI Hub's definition of inclusive design. This is not to say it's the only definition or the correct one, but for us, inclusive design can help all human beings experience the world around them in a fair and equal way. And with that, I am going to hand over to our first panel speaker, Mikaela Patrick. Mikaela, over to you.
Right. Hello, everyone. I can see that Jenny, our interpreter, is on screen, so I will get started. I'm Mikaela, and as Iain mentioned, I'm a senior researcher at GDI Hub, and I'm going to be talking today about the intersections between resilience and inclusion in urban development. Next slide, please. So here's a bit of an outline of my 10 minutes today. I'll talk a little bit about the background on inclusion and resilience in urban development and the conflicts between these two topics. I'll then give an overview of the study we've been conducting at GDI Hub that is specifically looking at inclusive design in cities, and with that present some insights on climate resilient inclusive design. And to conclude, I'll then link this to some wider themes and global development challenges and talk a little bit about what we think good might look like. Next slide. So why inclusive design for urban development? Well, firstly, it's about human rights. So the UN Convention on the Rights of Persons with Disabilities sets out the right to equal access and participation in society for all people, and especially for disabled people. Inclusive design is one of the tools that can help enable that participation. Inclusive design is also for everyone. It really does benefit us all, and good inclusive design is simply good design that creates a better built environment for everybody. It also adds value. So this is social value, strengthening our communities, but also economic value, enabling 15% of our population to better participate in society. We also strongly believe it's more sustainable when it's done right. And it's really important that it is sustainable in order to maintain seamless inclusion. There's also growing demand. So our population of disabled people globally is increasing, and we're also experiencing aging populations in most cities around the world, which is increasing the need for inclusive environments. We also think it's an essential part of meeting global goals, such as the Sustainable Development Goals. Next slide, please. Then how about resilience for urban development? Why do we need resilient urban development? Well, it's widely acknowledged that we're living in a climate emergency now, and there are various reasons why the built environment and the construction sector are really key areas to act in terms of the climate emergency. So it's widely acknowledged that the carbon footprint of construction is one of the biggest carbon emission producing sectors in the world. The energy consumption in cities is also particularly high. There are also various complex global sort of challenges that are happening in relation to climate, such as climate-related migration. So in some cases, people are moving more to cities due to the changing impacts of climate change. All of this is also creating resource constraints and increasing pressure on cities, meaning we need a solution to make sure that we can adapt to these changing circumstances, and resilient urban design is going to be a part of that. Next slide. However, resilience and inclusion can often come into conflict. So we often see solutions that have been designed for the climate emergency to combat climate change are not always designed with accessibility and inclusion in mind, which means that these solutions are then creating further barriers and exclusion for certain groups of the population. And this is something we want to avoid. A really common example is things like the massive growth of e-scooters and e-bikes, which are often left slightly unregulated, littering pavements, creating obstacles and hazards for people, well, particularly for pedestrians moving through the built environment. Then on the other hand, we also need to make sure that inclusive solutions are sustainable. And that's not always the case. So some interventions that are done for accessibility, particularly when we're talking about things like retrofitting, may involve more intensive use of resources, may involve large amounts of concrete to build things like ramps, which is not necessarily the most sustainable construction solution. So we need to make sure that we have that in mind. We also need to think about the longevity and sustainability of the designs themselves to make sure that things need less frequent repair and have a longer life cycle. A really common example of an inclusive solution, a sustainability solution that's not inclusive is the example of the revolving door, which is designed to keep heat in buildings and maximize energy efficiency. But it always requires then the use of a side door to provide seamless access for disabled people. And this then means that that door can still be left open, leading to heat loss anyway, and it at the very entrance of the building demonstrates that it's not a fully inclusive solution, it's a accessible solution, and that's something we'd like to avoid. Next slide. So we've been doing research around the world to look more closely at what inclusive design looks like in cities and what the current state of accessibility is in these cities. And I'm sharing this study with you today because one of the major findings has been around how important the element of resilience and climate is in that vision of a more inclusive city, because all of these cities are being impacted by climate. So we've been doing research looking at policy, looking at the lived experience of disabled people living in these cities, and trying to build a picture of what inclusive infrastructure looks like in those cities today. Next slide. So we're doing 6 case studies around the world as part of the UK aid-funded AT 2030 Inclusive Infrastructure Programme. These case studies are in cities in Mongolia, Indonesia, India, Kenya, Sierra Leone, and Colombia. And in all of these cases, we're working closely with local partners to deliver the research. Next slide, please. So I'm just going to give you a couple of insights from 3 of the case studies to give a bit of a sense of the different ways that climate and inclusion are intersecting in these cities. I don't have a huge amount of time, so it will be brief. So firstly, Ulaanbaatar in Mongolia, which was our first case study. Ulaanbaatar is the capital of Mongolia and has a population of around 1.3 million people. It experiences really extreme temperatures with winters of down to -40 degrees, which often last up to 9 months. So for a huge part of the year, it's extremely cold. This leads to huge amounts of fuel consumption, particularly in the unplanned settlements that surround the city as people struggle to keep warm. This is then creating large amounts of pollution and other environmental problems, which show that we need a solution for infrastructure that will work for the whole population. Next slide, please. So here are just a couple of images from the case study in Ulaanbaatar, which are looking to capture the daily lives of disabled people living in the city. I'll focus on the central image and the image on the right, which show one of our participants waiting for a bus in Ulaanbaatar. There's only one accessible bus route in the city, which makes inclusive mobility really challenging in the city. And because of the climatic conditions, it's really not feasible for participants or for people to walk long distances to access this one accessible bus route. So it really limits how much people are able to move around the city day to day. The last image is of one of our participants who uses a wheelchair in the informal settlements in Ulaanbaatar. And as you can see in this image, it's a steep, unpaved, graveled road in the informal settlement, which is extremely problematic when it gets cold and icy and slippery. And this lack of infrastructure in the informal settlements is really creating a large barrier to participation for disabled people living in the city. Next slide, please. Moving on to Varanasi in India, which was our second case study. It's a similar size to Ulaanbaatar. It's around 1.2 million people, but in the context of India, that's a relatively small size city. In Varanasi, what we see a different kind of climatic challenge where extreme temperatures of heat are a huge issue. So the kind of urban heat island effect is increasingly being a problem in the city of Varanasi, which can be a really congested and busy city. It's a very high density city. And this is exacerbating climate problems, which are in many cases likely to affect disabled people more seriously. Next slide, please. So the photo diaries here capture a couple of the priorities that disabled people identified during the research in Varanasi. So access to green spaces was something that people really valued. And I think we all know the positive benefits of accessing green space for our health and well-being. But in the actual city itself, it's quite difficult to access these green spaces. And participants also shared how some interventions to enhance urban greening have created accessibility barriers through things like tree roots growing up over roads and disrupting paving. Again, showing how we need to think about inclusion when we're doing, urban greening solutions. Then the final image on the right here is one of our participants looking out at the River Ganges in Varanasi. And I shared this image because I think something we forget about sometimes when we're thinking about climate and resilience is heritage conservation and cultural conservation, which is actually a big part of this discussion of resilience and forms part of the Sustainable Development Goals. In Varanasi, accessing these heritage sites is a really key part of daily life. And at the moment, it's not accessible for disabled people to experience these spaces equally. And that's something we'd like to change. Next slide, please. Very quickly, then I'll just mention Nairobi in Kenya, which was our fourth case study in the study. So Nairobi has a population of around 4.3 million, and around 70% of its population are living in informal settlements where access to basic infrastructure is really lacking. There's huge issues with flooding, particularly around kind of increased events of heavy rain, which is hugely disruptive to infrastructure as a whole and mobility in the city, but is also creating health impacts as the increase of kind of waterborne diseases and things can be traced to some of these flooding events. Next slide, please. Here you can see some of those examples of the kind of flooding and sewage and waste that we see in the informal settlements in Nairobi, which are extremely detrimental to kind of well-being in general and people's health and kind of participation in daily life. In the image in the center, you see a bit of infrastructure that's been built to help somebody access their home across an open drain. So it's a 3-stepped concrete sort of bridge that's been built so someone can access their home without having to sort of step across this open drain. However, this is not an accessible solution because it doesn't provide level access to the home. And we see this time and time again. Next slide, please. So I just wanted to end by quickly mentioning the sort of intersecting themes that we're seeing when we look at resilience and inclusion in urban development. So we see things like challenges around mobility, public space, health and mental health, issues around maintenance and sustainability, issues around good implementation and planning, humanitarian issues, the issue of informality and how to address, common issues in informal settlements, having accessible and affordable housing, and wider issues of social justice. And I included this here because I think it shows how we need the built environment to get involved here. There are so many things that built environment practitioners can contribute, and it's really for us and the sector to advocate, making sure that we include disability in these discussions. Next slide, please. So I'll end here by saying, disability really is a cross-cutting issue and links to all of the Sustainable Development Goals. It may be more obvious how it connects to SDG 11, which is sustainable cities and communities, but we see how infrastructure in the built environment impacts on things like clean water and sanitation, good health and well-being, climate action. And we'd really advocate for all built environment practitioners to think about how they can integrate more inclusion in their work. Next slide, please. I'll skip this one and then just move to the last slide, which is just saying the best way to do this is to work with disabled people, listen to disabled people. And we think that, if disabled people are front and center in how we're designing our cities, we will design more inclusive solutions for everyone. Thanks very much.
Thank you, Mikaela. That was great. So we'll move to our second panel speaker, Anna Landry, and we'll just give the BSL interpreters a moment to switch over. But yeah, I'll hand over to you, Anna.
Hi, everyone. My name is Anna. I'm a PhD student in computer science working with GDI Hub. And I'm going to be speaking about disability in the built environment in humanitarian contexts of climate-driven crises. because I think this is an area where barriers and inaccessibility of the built environment can become quite deadly. And there's a lot of interventions that we can make to ensure that that doesn't happen. Next slide, please. So as I think many of us know, climate change is causing more frequent and more severe disasters, including natural disasters like hurricanes or fires, but also events like drought, famine, heat waves, and more that can create a humanitarian crisis. And while in this area, we're really only beginning to gather great statistics on the plight of disabled people in these events, the evidence that we do have shows that disabled people are 2 to 4 times more likely to die or sustain a critical injury in the event of a disaster. And in line with the social model of disability, it's very documented that inaccessible built environments are a large driver of risk here. And I'll go into some examples of this shortly. So essentially, if we build more inclusive spaces, disabled people will have better chances of surviving climate-driven humanitarian crises. Next slide, please. And here I have a quote from Dr. Julia Watts-Belzer, who is a professor at Georgetown University and a really great writer and researcher in the area of disability and climate change. So I encourage you to look into her work if that's of interest. And this quotation is, if we persist in framing disability and climate change as a problem of physical vulnerability, we miss the underlying realities of structural violence. So this is just to say that, of course, disabled people have many body or mind variations that might make them more biologically vulnerable to these crises. A lot of times it is the environment around us as disabled people, for example, I'm a wheelchair user, that create this vulnerability where there doesn't have to be some. Next slide. Thank you. So what risk can the built environment pose for disabled people in a disaster? Like I mentioned, in a crisis, inaccessible environments become deadly environments. And for those, I have a list here of some important features, and I'll kind of go through them in relation to different disability types and how they might interact and play out in a disaster. For those with mobility disabilities, a lack of step-free transport options or accessible pedestrian pathways would make it impossible to evacuate your city in advance of a flood, or go to the store to stock up on essential supplies, perhaps before a snowstorm. Additionally, things like fire doors without power assist mechanisms or automatic opening mechanisms could leave you trapped in a burning building. For deaf or hard of hearing people, alarm or warning systems that rely just on audio cues might leave them completely unaware of a crisis situation and unable to protect themselves. Or for people with intellectual disabilities, a lack of clear signage could make an emergency procedure confusing or distressing and prevent them from acting in accordance with the emergency procedures. Or for blind or visually impaired people, a lack of braille signage, tactile paving, or audio described cues could impede their movement or their correct action in the event of an emergency. And then one thing that I think is often very overlooked is electricity or power supply, which when we lose power in the event of a disaster, this might be inconvenient for some, but for others who have complex medical needs, who use a ventilator or another medical device, it could instead be a matter of life or death. And I also want to add that this is an incomplete list. Disability is a really wide-ranging phenomenon, and every disabled person and every environment is a bit different. So it's important to use this as examples, but not as a checklist or complete guide. Next slide, please. So now I'd like to talk briefly about the case study a case study of some hurricanes. A lot of the literature on disabled people and disasters is clustered in the United States and around hurricanes, interestingly enough. So we're working on kind of building that out. But as of now, this is one of the more complete pictures that we have. And in these hurricanes, specifically Katrina, Rita, Sandy, and Maria, you had problems like evacuation buses that didn't have lifts or ramps, shelters without accessible entrances or bathrooms, particularly those that were built as trailers or in mobile homes. There were inaccessible warning alarms and queues. Mobility disabled people became trapped in high-rise buildings when the lifts weren't working. And when the electricity went out and the lifts didn't have a backup power supply. And additionally, the lack of backup power supply for medical devices in homes and institutions was a big source of risk. And finally, a lot of medical service locations, so emergency clinics, were placed upstairs or in similarly inaccessible locations. Next slide, please. So here I have a quote from Marcy Roth, who's another fantastic leader in the area of disability and disasters. She currently heads the World Institute of Disability. And during Hurricane Katrina, she was heavily involved, particularly with attempting to save a woman named Benilde Caixeta, who was a wheelchair user who tragically died in the hurricane. And I share this story because it's become a really tragic cautionary tale for these situations, and one that I think sticks with people. So the quote is from Marcy. On August 29th, Susan Daniels called me to enlist my help because her sister-in-law, Benilde Caixeta, a quadriplegic woman in New Orleans, had been unsuccessfully trying to evacuate. I stayed on the phone with Benilde for the most part of the day. She kept telling me she'd been calling for a ride since Saturday, but despite promises, no one came. The very same paratransit system that people can't rely on in good weather is what was being relied on in the evacuation. I was on the phone with Benilde when she told me, with panic in her voice, the water is rushing in. And then her phone went dead. We learned 5 days later that she had been found in her apartment dead, floating next to her wheelchair. Benilde did not have to drown. So this is an example of many things that went wrong. Several failures are in here. The regular, in air quotes, regular evacuation buses were not accessible. The paratransit wasn't reliable. And there was no feasible, accessible pedestrian route from Benilde's home to the area that was sheltering people, the Superdome. Next slide, please. And I also want to encourage us overall to take a disability justice approach to designing built environments for climate resilience and disasters, which means that disabled people and organizations need to be considered and included from the planning stages of any built environment. I think Mikaela mentioned this. And we have to take a holistic view of disability as well. Disabled people are not just wheelchair users. And I think, unfortunately, that's often who spaces are being designed for, if they are being designed with any disability in mind. But instead, we have to take a more holistic approach to the whole of the community. Additionally, it's important to think intersectionally. Maybe the wheelchair user or deaf person that you're designing for is also a parent with small children. And that introduces different needs in the event of a disaster or in whatever you're using a built environment for. And another really important point is to resist ableist assumptions about who is assistable or savable in a crisis. Dr. Watts-Belzer has talked a lot about how too often there are these thoughts that, well, not everybody's going to make it in the event of a disaster. And so we don't have to design for every need in mind. And this turns into a self-fulfilling prophecy. Because of course, if we're not designing in ways for people to survive, they're not going to. So it's important to avoid that. And finally, it's important to see reconstruction and recovery after a disaster as a huge opportunity to build more inclusively. I've been doing work lately in Ukraine, and now we're pivoting to thinking about rebuilding cities that have been destroyed in the war. And how can we do that in a way that's inclusive of disabled people? Whereas many cities with older inaccessible infrastructure were really not consistent with principles of inclusive design, and looking at how we can take a tragic event and turn it into an opportunity to build back more inclusively. Next slide, please. I want to close with a quote from Hidman Parodi, who works for the Partnership for Inclusive Disaster Strategies. He's a co-director there. And he is the first person with a major spinal cord injury, wheelchair user, to be deployed in an active disaster situation as a responder. And he and the partnership do really great work, which I encourage you to look into. And this is an excerpt from his interview in the Disability and Climate Change Public Archive, which is another great resource. Hidman says, growing up, I did not see people with visible disabilities in the disaster response world. If they existed, I didn't see them. What I did see was this. When disability-led organizations are not involved in recovery efforts, a less accessible world tends to be constructed. And I think this goes back to this overarching theme that both Mikaela and I have mentioned, which is that disabled people need to be included from the planning stages of any space, because disability is such a complex and unique experience, a lived experience, that people who haven't experienced disability or who have only experienced one facet of it are not going to be able to design for the whole community. And it's really important to acknowledge and respect that. Next slide, please. And these are just some resources, many I've already mentioned, and the slides that got sent out will have links so you can reach them. And now I'll hand it over to Shivani.
Thank you, Anna. That was great. So we'll hand over to our third and final speaker, Shivani Gupta, and just give a short pause to allow our BSL interpreters to swap over. I see a couple of questions in the Q&A box. That's good. Remember to keep your questions coming, and we'll try and get to some at the end. Otherwise, over to you, Shivani.
Thank you, Iain. Have our interpreters been able to change? Just making sure.
Yes, go ahead.
Great. Thank you. Yeah. So thank you, Iain, and hi, everyone. I am the technical advisor on inclusion with CBM, and it's really great for me to be here to make a presentation that looks at priorities for the Asia Pacific region. But I generally address the challenges and provide some recommendations. Next slide. So I begin first by giving a little overview of the presentation. I will start by setting the frame of the presentation by sharing some facts about Asia Pacific region in relation to climate change, and talking briefly about the link between disability and poverty, especially because the intersection of these with climate change disproportionately increases the risk of negative impact of climate change on persons with disabilities. Then I would elaborate on the impact of climate displacement on disability, followed by some key milestones, both global and regional that promote inclusive climate change. Then I would highlight on some of the challenges in disability inclusive climate change, and finally present my recommendation. Next slide, please. So why is it important to consider inclusive climate change in the Asia-Pacific region? So Asia-Pacific region is the most vulnerable to natural disasters, with many informal settlements located in fragile environmental areas on seashores and major river basins. Asia-Pacific recorded the highest number of displacements between 2010 and 2021, with over 225 million as a result of climate-related hazards, including droughts, extreme temperatures, etc. While there is no data on how many of them were persons with disabilities, but according to a very recent WHO report, there is about 1 in every 6 person who is a person with disabilities. So we can imagine the number. So Asia Pacific has the second highest prevalence of food security, which can be a big outcome of climate change, with 48% of the population deems food insecure. And with a close link between disability and poverty, we can expect that the large number of persons with disabilities are the ones who are impacted by this food insecurity. However, again, there is no disability disaggregated data present. Then by 2050, 2/3 of the population in Asia Pacific would be living in urban cities. And Asia Pacific hosts half of the world's slum, or let's say informal settlement population, with growing urban poverty and inequality. We can go to the next slide, please. So Asia Pacific is home for over 70% of the global population of persons with disabilities, which is around 690 million people. They are amongst the poorest and lack access to education, social protection, health, social care services, employment, livelihood opportunities, etc. There is a very close link between disability and poverty. And extreme poverty causes disability due to many factors such as malnutrition, inadequate living arrangement, access to health services, etc. On the other hand, people with disabilities are especially affected by poverty and often excluded from accessing services like education or work due to barriers in their environment, thus becoming trapped in poverty. And social and economic exclusion and stigma faced isolates them from human development, and they remain in the infringement of social economic activities, which results in their reduced participation in decision making and getting left out and forgotten from different processes, such as those for building climate resilience. Next slide, please. Picking on this further, climate risk is seen at the intersection of hazards, vulnerability, exposure, and climate adaptability. Unpacking the heightened risks encountered by persons with disabilities, as I already mentioned, Asia Pacific is most prone to natural disasters in the world, with a high number of man-made disasters as well. Climate change and extreme weather events increase the incidence of disability through injury and impairment. Disability-specific needs such as accessibility, assistive devices, support services are often unaddressed. That makes it difficult for them to stay informed about the disaster or to evacuate. Further, being clubbed with a larger vulnerable group prevents specific attention that needs to be paid to ensure that persons with disabilities are included. Then persons with disabilities are overrepresented in poverty, and it is well known that persons living in poverty are more at risk of exposure of extreme weather, poor access to health and other services. And finally, persons with disabilities encounter aggravated challenges of adapting to climate risk because of inaccessibility, inadequate safety net, lack of community engagement, etc. Next slide, please. So climate change often results in displacement and internal migration. And often, as a result of climate displacement, families migrate to urban hubs for better opportunities. Most of the disaster or climate displacement are in the Asia-Pacific region, as I mentioned earlier. And people with disabilities report feeling particularly unsafe and at increased risk when their support networks break due to migration, and the stigma and discrimination that they face. And the relocation does not always improve their situation in any way. Relocation to unfamiliar places can be challenging, especially because of inaccessibility. And very often people migrate due to climate risk are often those who find shelter in informal settlements or slums. And these high density settlements are completely inaccessible, as even Mikaela mentioned, to persons with disabilities, often making them completely homebound. Then urban hubs are no longer places of unlimited resources, and such displaced persons, specifically persons with disabilities, experience poor access to basic services such as health, education, transport, etc., and find it difficult to earn a livelihood. And this in turn further traps them into poverty, and they continue to face greater exposure to climate change. Next slide, please. So now very quickly, I'm going to go through some global and regional frameworks that exist that are promoting inclusive climate change. The first actually was the United Nations Framework Convention on Climate Change, which is in fact really the key document guiding climate action. However, there is no reference of persons with disabilities. It was only after 2006 when the Convention on the Rights of Persons with Disabilities came into force that there is a growing recognition of inclusive climate change. It was in 2010 that the Cancun Agreement recognized the disproportionate impact of climate change on persons with disabilities, followed by the Doha Work Plan that recognized the need to prepare different groups of people, including persons with disabilities, to adapt to the impact of climate change. And while all this was happening in climate change, simultaneously on the side of disability, there was the Incheon strategy, which was the ministerial declaration on the Asia-Pacific Decade of Persons with Disabilities, and the strategy is a mechanism that the region has adopted to implement the Convention on the Rights of Persons with Disabilities. And one of the goals of this strategy relates to disability inclusive disaster risk reduction. Then in 2015, there were several very major steps or progress that happened towards disaster and climate change matters, and also in terms of inclusive climate change or disaster risk reduction. For instance, in 2015, the Sendai Framework on Disaster Risk Reduction called for integration of persons with disabilities in all policies and practices for accessibility and data, which is disaggregated based on disability. And the framework places persons with disabilities as partners to lead universal accessible approaches to respond to recovery, rehabilitation, and reconstruction, and to ensure Build Back Better. Then in 2015, the Agenda 2030 and the 17 Sustainable Goals, something that even Mikaela pointed out, the interdependence of the goals links the goal 13, which is on effective climate action, to goal 11, which is on building cities that are safe, inclusive, and resilient. And then it was also in 2015 that the Paris Agreement was signed, and the preamble of the agreement required all country governments to respect, promote, and consider the human rights of all people, including persons with disabilities. Then there was the New Urban Agenda that refers to climate change in urban contexts, addressing accessibility and universal design. Then it was during COP26 that there was the formulation of the GLAD Disability Inclusive Climate Action Working Group, chaired by the World Bank, the ILO, and the International Disability Alliance. And it has very key members who other development cooperations and other actors, important actors who can make a significant impact on inclusive climate action. Then the most recent I'd like to point out is the Glasgow Pact, which strongly embeds the state duty to take action to address climate change from a human rights perspective, and respect, promote, and obligates them to uphold the rights of persons with disabilities and other groups such as indigenous groups, migrants, children, etc. So while a human right approach towards disability inclusion is really creeping into the global frameworks, but the implementation at the national and local level still remains very siloed. And as a result, disability inclusive action has been limited. Next slide, please. So what are some of the specific challenges in disability inclusion? So most often, voices and demands of persons with disabilities get left out, and they get lost in all other competing priorities. And persons with disabilities and their organization may not really be updated about the climate risk and the urgency to build inclusive resilience. And then decision makers may not fully consider persons effects on persons with disabilities have not been studied as much as other vulnerable populations. Then there is an inadequate persons with disabilities, such as heat and water stress, internal displacement, informal settlements, etc. And finally, and extremely important, is that mechanism within the country may not be fully inclusive and therefore not support inclusive climate action. For instance, there may be a lack of inclusive design standards and legislative frameworks. The concept of Build Back Better may not always adopt inclusion, and the planning processes may not be inclusive. All of this which has an impact on climate action as well. Next slide, please. So I would like to end with a few recommendations and priorities from my perspective. First, all development projects must build resilience for everybody, including persons with disabilities, and adopt inclusive design standards in Build Back Better of all reconstruction. Then there needs to be awareness raising of the decision makers about specific requirements for inclusion of persons with disabilities, and simultaneously organizations of persons with disabilities also require awareness raising in different aspects of climate change. Steps may be taken to consult persons with disabilities and engage them in decision-making processes for development and climate resilience projects. This is something that Mikaela as well pointed out. Extremely important. Persons with disabilities need to be at the center. Then there needs to be an increase in research on topics related to inclusive climate change, generating specific knowledge on understanding issues such as heat, water stress, informal settlements, migration, resilience from a disability inclusive lens. And then finally, I think country level mechanisms need to be strengthened and to become more disability inclusive. And here, national advocacy groups and persons with disabilities and their organizations within the countries can play a very important role to achieve this. So thank you. And with that, I hand it back to Iain.
Thank you, Shivani. I'll pause at the end here just to let the BSL interpreters hand over. Perfect. So we've run just marginally over time, but I do see that panelists have been answering some of the questions in the box. So that's excellent. I wonder if we might just do one question, which may have been answered. I've been trying to keep up, which is quite difficult. But there was a question that was unanswered a moment ago about the role of the state. So, you know, what is the role of national, of local government to get this right? And I wondered if, I think Mikaela may have typed the answer. So I wonder if just very quickly, just to make sure that we've covered a question at the end here, Mikaela, if you just quickly jump in and give us your view on the role of the state, national, local government to really support better inclusive climate resilient planning and delivery.
Sure, thanks, Iain. So as I mentioned in my typed answer, most countries are signatories of the UN Convention on the Rights of Persons with Disabilities, which is really the global policy framework that underpins why states have responsibilities and should be acting and integrating disability inclusion across their development work. And I think that's really the starting point. But from there, there's also then a need for national legislation that upholds those rights within the specific country. And in most cases, we then also need local government legislation. So we need policy to be working at different scales in order to really integrate and implement good disability inclusive design. And that normally means that, let's say at the city level, we also need legislation or bylaws or standards that dictate how we integrate disability and inclusive design in that specific city, because we know, although there are shared challenges, every city is also unique, and it's important that the local legislation reflects, a real picture of that city itself. So of course, states have responsibilities. And what I'd end on is just saying that, please remember that disability isn't or shouldn't be a siloed sector, and often that is how it is treated. But we should be thinking about integrating disability, inclusion, and inclusive design across urban development challenges. So I think in the question, the attendee mentioned things like food insecurity and interventions for poverty. These are all things that should always be thinking about disability as well. Thanks.
Thank you, Mikaela. That's perfect. So we've run out of time. I think the information from today will be shared. I'd just finally like to do a vote of thanks. I'd like to thank the Bartlett for running today's session and the team there, Alma, of course. I'd like to thank our fantastic panelists. So thanks to Mikaela, thanks to Anna, and thanks to Shivani for joining us today. I'd also like to say a big thank you to our BSL interpreters, Darren and Jenny, for doing the interpretation for us today. If you used the BSL interpretation, if you could please share your feedback via email at bartlett.comms@ucl.ac.uk. That would be much appreciated. Thank you so much for joining. We hope you've enjoyed the session. And from all of us here, it's goodbye. Bye.